what are the biggest differences between men getting on TRT when they're very young, relatively 30, 35, in comparison to when they are a bit older, 45, 50 or over? Are there any differences? And if so, what are they?
Yeah, it's common to see both of these age groups. We see everyone from very young, fairly young ages, even in their 20s, all the way up to people who are in their 80s still wanting to optimize their health. So it's not uncommon that I see a patient in room 1 that's 30 years old and a guy in room 2 that's 60 years old. And when you look at their lab results and you don't know which one's which, they look almost identical. So the first thing I would say is there's a lot of similarities between the two. They oftentimes have the same severity of their symptoms and they have the same severity of hypogonadism in their lab results. The differences between the two is that when you give a 30-year-old testosterone, he might improve a little bit faster because he might not have as many complicated other medical issues going on at the same time. You might not have as much polypharmacy going on, although that's not always true. We have a lot of young guys being put on a lot of medications early on too now that complicate things. But I do sometimes see those 30-year-olds improve a little quicker right out the gate with just testosterone versus the 60-year-old oftentimes needs other hormonal support and consideration of other issues like microvascular damage, if their main concern is erectile dysfunction or even endurance and cardiovascular health.
Yeah. What I've learned through the years doing these videos from Dave Lee and as from Dr. Keith Nichols is that men that are a little bit older, 45, 50, they might all need optimization of all the hormones at once, pregnenolone, DHEA, melatonin, and so on. While the younger guys can start out with just testosterone and they won't probably need the DHEA and pregnenolone. Is that also your experience?
Yeah, I agree with that. And then also mentioning thyroid in there as another thing to look at and consider as part of the whole picture. But thyroid's one that some younger guys do need as well. And even though some younger guys don't need DHEA and pregnenolone, there oftentimes are still some issues there with younger guys too, especially I see with shift workers and like veterans too. But I do agree that usually it's the older guys that you have to look at starting all of those things at once. Some other differences would be, the younger guys are more prone to side effects like acne. I don't oftentimes have 60-year-olds experience acne on testosterone, but the 30-year-old usually has at least a little bit, if not more moderate amounts, which I'm sure you have a lot of experience seeing too.